Hi, my name is Nicole, and I'll be doing two demos today. One is the field test for the Thomas test, and one is a joint assessment assessing ankle dorsiflexion. I'll be using a gonometer for that test. This is my client Jim here. He's in my master's class. The first test we're going to do is the Thomas test. We're going to assess our hip flexor, and we're seeing how much flexibility we have in our hip flexors, specifically the iliopsoas muscle. The primary joint there is the hip joint. So to perform this, I'll have Jim lay back onto the bench and then bring one knee into his chest. So he'll bring this knee into his chest. Great. And what I'm looking for here, you can extend this leg, extend it out. Great. And I'm just seeing if this leg, the thigh that's extended, is lifting off the bench. And it is lifting just barely. So that tells me, you can relax, Jim, that he failed the test essentially. And we practiced this actually just before we did the workout and after the workout. Before we did the workout, he passed the test. After the workout, he failed the test. That's okay. So what I would prescribe for Jim in this scenario is a kneeling stretch. So come down, maybe he has something to hold on to here. Kneeling, you can sit up, Jim. Grab his leg behind him, and he's getting a stretch here through the hip flexor. And that might not be available to Jim, so we would assess what would work with hip, working on stretching that hip flexor there. 20 to 30 seconds per side. Okay, next we're going to jump on this box and we're going to assess our ankle dorsiflexion. So I've got Jim up on the box. We can see his feet there in the video. This is assessing the flexibility of his ankle joint. We are looking for our plantar flexor muscles here. We're going to extend and flex that foot up. I'm going to use the gonometer starting at a 90 degrees here. I'm going to come down and put that gonometer right over his ankle, right the bony point there, and make that 90 degrees, and he's just got his foot flat there. Now I'm going to ask Jim to flex his foot, and when he flexes his foot, then I can see to what degree he can bring his foot up to. So I'm at 90, he's flexing right now. Jim has about 12 degrees there. And again, incidentally, before the workout he had more, after he's a little bit, has a little bit less, and that's okay. So what I would suggest to Jim is a stretch called a calf stretch, a standing calf stretch. So with the standing calf stretch, I would put one foot forward, one foot behind me, and push my knee forward here, getting a nice stretch in my back leg. I'll show you to the side, stretching my calf leg. Again, 20 to 30 seconds per side. Thank you so much.